Hello, welcome to what is, I think, possibly the first in what could be called a series of interviews called What Have You Done This Week to Make Someone's Life Better? I've certainly picked that as the theme for this interview because every week, every Friday, I put out a tweet which says that very thing. What have you done to make someone's life better? And I recently learned that someone I know, Andrew Larner, had been inspired by that tweet to do something which is probably going to make an awful lot of people's lives better. Andrew is the chief executive of IESE, which is a organisation which exists to improve public services and has a whole network of public service members in its membership. He also has his own company, Larner Associates. And over the last few months, Andrew, inspired by my tweet, as I said, has been working to try to learn some of the best practice which has existed in dealing with the COVID-19 outbreak in other countries, and to try to introduce some of the methodologies from other countries which have made life safer for people in those countries, which have not been adopted in this country. Why they've not been adopted in this country, that's probably a topic for another discussion. But the things Andrew is doing is quite revolutionary, really. In UK terms, at least. He's sourcing PPE, for instance, in greater quantities and at lower prices than it was been thought possible to get. He is making buildings safe from COVID for long periods of time. He is introducing systems of testing people for COVID-19 more frequently and more easily than is currently available. Andrew is particularly interested in schools and has a system which he thinks can make a school COVID safe. But it can also be applied in other settings, and I'm thinking particularly of settings like theatres, performance venues. We've got whole sections of our economy which are not functioning at the moment because they are deemed not COVID safe. I think that what Andrew and his colleagues are doing could address that. I think what I've learned from Andrew today as part of this interview has quite revolutionary implications. It really ought to be adopted more widely. That's why I present this interview to you now. Here's Andrew Larner. He's got some really interesting things to say. He's doing some very interesting things. So please listen to this interview and then think for yourselves, what are you doing to make someone's life better? Right, okay. Well, Andrew, thanks for making the time to talk to me. You're someone I've known a little bit. We've done a little bit of work together. Hopefully we'll do a little bit more work together in the future, viruses and lockdown allowing. But the thing is, when I've been looking at Twitter in particular over the lockdown period, I keep seeing you popping up with you've done this and you've done that, all very interesting initiatives, I think, which are things which are helping us to deal with the virus, which I think deserve a wider audience. So I suppose, first of all, can you just tell us a little bit about your background and maybe move from there to how you got into exploring doing these things that help in the current situation?
Yeah, so I mean, my background is I've always worked in local public services, but trying to bring innovations from outside public service into public service, things that would make a meaningful difference to the everyday life of residents and local businesses. And to me, that's the acid test, of whether it's worth doing or not. And I've done that in over 20 countries around the world before moving back to the UK to do that here nationally, and then initially regionally. Now what we're doing with IESE is expanded across the whole of the UK. And one of the, I think, the great strengths of those in local public services, that they are very good at sharing their knowledge and best practice. And I think that there's a number of lessons in the current pandemic situation where at the local level, councils, their staff and their elected members have done some fantastic things. But I think, to me, it looks generally nationally, and that's not about national government per se, it's national government and local government. I don't think we were learning the lessons of other countries well enough. And so as a sort of a spare time activity. It's actually your tweet that started it off, John, because you said, "What have you done what have you done this week to make a difference?" And I thought, yeah. So what? Don't sit here whinging about it. Do something about it. So I contacted a series of people in business community that I knew, and we started off looking at PPE, and I can go into that a bit more because that is interesting in its own right, and why we as the UK were at the back of the queue compared to other countries, and then looked at from there on to testing and what's happening there. And then probably more by accident, we also then found some simple technologies that when you apply them would make an environment safe for some means of transmission of COVID. So we started to think, actually, if we could integrate all of this best practice, what we could get to, which is the point that come back to what makes us tick, is that meaningful difference to residents of business. We want the public, parents, pupils, teachers, people in offices, in retail, to be confident that they can go about their daily lives safely, and that to be meaningful and truthful and trustworthy. And so we've tried to create for each environment, what would be the protocol to make a school safe? And what would be the protocol to make an office safe? What would it be for an event? And frustratingly, actually, what we saw was the people with a lot of money, so film and sports, they were getting back to work again because they were able to afford what was actually quite expensive. So then the other aspect of the problem became, how can you move up the supply chain to make that affordable for everyday life, not just those industries that are much better financed than local public services. So that's where we've got to. We've now got to the point where we have a range of solutions which brought together can make a school a safe environment, at least more safe than home, actually. And we can make an office a safe environment. We can make a school bus a safe environment. We can make a ship, because maritime shipping is a particular issue, with import, export, etc. A safe environment. And we're talking to a number of places where they're islands that have no COVID, and how they maintain that status without losing the freedoms that they currently enjoy. So that's the journey, without sort of saying something specific about the technologies we're using. That kind of gives you the flavour of why we were doing what we're doing and where we've got to.
Really, really interesting, and certainly all power to your elbow. So do you want to tell us a little bit about the technical aspects of what you've actually been doing?
Yeah, so at its basic, you essentially are trying to remove two things: human to surface to human infection, and human to human infection. And of course, we're familiar with PPE in that regard, although another added thought that we have is the environmental damage of the high volume usage of PPE. I live by the coast, and everywhere is strewn, the floor is strewn with PPE. It's all washing into the sea. You can see it's the next plastics island in the middle of the sea is going to be PPE masks. In looking at that, we have effectively identified and now have it is a technology. I always think you see these adverts for L'Oreal and other products where they have quasi-scientific explanations of what they do, and they've just changed the colour of the label. So when I first saw this liquid, and it's called a nanotechnology, I thought, pull the other one. It's not that, but actually it is. So essentially, the size of the droplet of when you spray, the way you spray the stuff, is nano level, and it leaves literally like a glass layer over every surface in the room. And the chemistry of it is such that it continually kills COVID. So that means if someone, if you've got a school environment, you've got the situation where perhaps an infected child comes into the room, or an infected teacher touches a surface and goes out. The PHE, the Public Health England government guidelines, say you've got to deep clean and you've got to do it frequently. Well, it doesn't matter, because actually, if 1 minute after you've cleaned, someone infected comes in and touches a surface, that room is infected, and it can be passed on to someone else. Whereas this, for up to 10 days afterwards, it would just kill what touched the surface. So you've immediately got one line, one vector of infection completely removed from the scenario. The practical impact that for a school, to take a practical example, is that the head teachers that we've been engaging with saying they are rotoring schoolrooms out of usage because deep cleaning takes so long. So they've got less classrooms at a time they need to socially distance more. So they've just increased the possibilities of human-to-human infection by taking the surface cleaning out. So what this would do would mean that you can actually clean in 40 minutes what would take many, many hours to do. And basically you go into the room, you press a button, you walk out because you don't want to breathe the stuff in, you close the door, after 40 minutes you go in, you pick up the nebulizer and you walk out again. And that place is now completely COVID free and will be for 10 days, or if you wash the room, you know. So actually, you've just saved a huge cost. The other huge cost is that children shouldn't share equipment. So you can imagine a music class, everyone's got to have their own set of instruments. You know, so it's huge. So actually, again, you can coat these things, and actually means that the equipment can be shared. So you've taken a massive cost out for the sake of it is slightly more expensive, but it's a cleaning material. So it's a very simple solution, very, very easily deployed, and it's very, very effective.
You say it's very simple and can easily be deployed. So why isn't it being?
Which was funny because actually the technology has been around for some time, and when we spoke to the manufacturer, it's not in this country, so that might be part of the issue. They had tried some years ago to sell it to the NHS, and the NHS had turned it down. It's again, it's procuring to the lowest level rather than actually thinking about risk and how you manage it, and picking up on best practice. All we've done is take the best practice lens. We've gone through a supply chain that we have that stretches right around the world. So we have within our team, you know, the people that supply 18 of the 19 commodity supplies contracts to NATO, for example. There's a massive supply chain in this, which means we can reach out through that and say, what is the best thing for this? And we can discover things that perhaps others wouldn't necessarily discover. So it's that best practice sharing bit on speed, really. So honest answer is I don't know why they didn't buy it, but it's disappointing that they didn't, because actually that would mean the NHS would have been several years ahead when the infection hit. So we do know that other countries are using it actually in volume. So it's CE certified. It's got use cases. So there's no reason why it shouldn't have been deployed at all, other than nobody knew it existed in this country.
Yes, I think that's a very common story. Really, is the way we've done this is that we don't believe there are any answers beyond our borders, and that's been very damaging, I think. So what's the reaction been to the people that you've taken the solution to?
Where do I sign? I think is probably, this is a relatively easy one. I mean, now our lead time has been more around setting the company up and getting the distribution sorted so that we can scale quickly. There's absolutely no reason, because we're talking marginal costs of business to shift this into it, really. So it's not, I mean, there are the foggers and the nebulizers are the expensive hardware bit, but once you've got that, and naturally if you go around any town centre, they're fogging and they've got foggers and so on, so actually you're just changing the content of what they're putting into it, really. So it's a bit of a no-brainer. So the other things we've been looking at then is around human to human, and obviously the PPE is a part of that. But if you look at the government guidelines for a school are, if a child starts to exhibit symptoms during the day, isolate them and send them home. So the question is, to what extent child will say, actually, I've just got symptoms. One of the ones you can look at is temperature. It's not, a large number of people don't exhibit a temperature difference, but if they do, it's a good sign. And so what we've looked at is the different temperature sensing technologies, and what we've got is a camera system that links to artificial intelligence that will identify this part of the face, will test from a distance of, could be 20 meters, the temperature 0.3 of a degree. It has to be indoors, not outside. and you can have a crowd walking down a corridor of children, and it'll pick out the one that's got the high temperature. And they could even be wearing a balaclava, and if they held a cup of coffee up next to their face, it'd still pick the face out and not the high temperature of the coffee. So that's very effective and simple, not comprehensive, and it's only the symptomatic that it covers. So the thing that we were trying to achieve, the gold standard, would be actually we should be testing children routinely. If we care about children going to school as much as we do our footballers and our TV stars, then we would be testing them regularly. And it takes about 3 days to 4 days for a viral load to build up to become infectious. So if you had a regime of being able to test children twice a week, clearly the tests aren't 100%, but they're close to it, then you could make the environment pretty safe, as near as damn it safe as it can get, and the tests are improving. So we were looking at that, and initially we had looking at the South Korean system, which had been moved really effectively there, but the unit cost and the speed at which it processed the tests were not really good enough for that school environment. You could have thought about it maybe for teachers or so on, but if you look at what the football and TV industry, they're paying about £300-400 a test. And if you've got a class of or school of 1,000 pupils, testing them twice a week, you're talking million plus quid a year on your bill. So that, unfortunately, but we kept looking, and we've now got a test which is simple to perform. It's based upon, it's the same as if for a diabetic testing their blood for blood sugar levels, essentially 2 drops of blood on a test kit, and 20 minutes. So, and the price at the moment in the market is about £20 as opposed to £300. So all of a sudden we've got a bit of a game changer there, and then we think over time that price we can drive down as volume goes up. So we can conceive of testing every child twice a week. And if you combine that with the cleaning, combine that with the thermal imagery, all of a sudden you've become what we call COVID confident.
And can I ask you just exactly what form the tests take? Because I've had the swab test 4 times now, and it's not very pleasant. I can't really see that kids will be happy about doing that twice a week.
No, that's exactly right. That's part of the reason we weren't convinced about. So the current test is equivalent of sticking a biro up your nose, because it's actually slightly longer than a biro, and then down the back of your throat. And even medical people don't like it. So we're talking to one hospital and they've got the standard test, but then none of the medics want to do it. So no, this is not invasive at all. So it's literally, and clearly it's not pleasant, but it's a lot less unpleasant. So I used to do it for my wife. She had gestational diabetes. And so your little pinprick on the end of your finger, 2 drops of blood onto, it's a piece of paper, but essentially it's a little electronic kit, about 2 inches long. You just dab your bit of blood onto the exposed area, and you wait 20 minutes, and it has a clear indicator that you've got COVID or not. So so the accuracy of the kind of swab tests at the moment is about 98% for the best machines. I haven't seen the results, but I don't think we're performing that accuracy, because if you touch the lips on the way out, or you don't do it exactly right, then that test is a waste anyway. And then we have a large number that are lost on their way to the lab and all that kind of thing. You'd have been able to do there and then. You'd be able to do it within a registration period, and before children were released into the school population. So it's a lot simpler. So it does, people don't like having needles stuck in their fingers. It's not a great thing, but we do it for other medical reasons. So, and this is a pretty good one. So it's a huge game changer compared to the typical swabbing approach.
Okay, that's good. That's good to hear. It's good to hear. Okay, so what can we do to get more adoption of this kind of approach, Andrew? I mean, it seems to me that, as you say, other countries are doing it at scale. What are the obstacles to doing it on scale here?
Well, you probably need to ask me that in about a month's time, because at the moment we've got a queue of people that have already formed that we're talking to. So we've had a couple of local authorities already, even though we've not set up yet, where we're talking about home to school transport. We've already got, so in that environment, we created the protocol, so the bus is the safe environment. We've already got our first offices underway, and we've got the 3 schools that we're talking to, and then we've got a client I can't say yet, but they're looking at initial order of 10,000 test kits to cover their hospital and their area, and creating a COVID safe bubble. And then there's a couple of seaside towns where the council's asked us to look at the main buildings like the theatre, the pubs, and they're bringing together all of the hotels for the area, so we can create a single protocol for including taxis as well. We've had some discussions with people responsible for the Excel, and we're shortly to talk, we hope, to the NEC. And there it's not just making the environment safe, but travel to the environment safe as well. So that's why the transport side of it needs to be addressed. So at the moment, we're not finding any blockages. The concepts are simple enough for people to be able to see. It's a question of affordability and price point. And I'd like to see those test kits come down to the sort of between £5 and £10 level actually, which ideally, as the volumes go up, we can drive that down. I know that Germany, for example, has already ordered just a million of them, and I bet they've got a better price. I've got our first load. I'm expecting to come off the ship in the next day or two, and we'll be shipping them out to the first customer.
Right. Okay. So through adopting this kind of approach, could some of the industries which were still suffering and still have their premises closed open up again? I'm thinking of theatres and places like that.
Yeah, absolutely. And then, of course, there are some inconsistencies with which because essentially they're large volume buildings with people moving around them. That's essentially the only difference. But some buildings have been able to open and some not. Now they're talking potentially about some things having to close because it's a compensation for schools opening up. And we are now part of a global network of medical and research people. We're probably the only sort of imposters in the room, but from countries around the world, and we regularly and the view there is, even with a vaccine, we're talking about at least a couple of years in the current dance with COVID. A number of jurisdictions, and New Zealand's amongst them, are saying this is here forever. We live with this as if we've got it forever, because actually even if it goes away, we don't want to lose the knowledge and the approach, because if it's not this, something else will come back again. So we're talking about adaptation, not recovery. So what we do is we build these protocols as best practice into our normal way of doing things. They're part of our normal health and safety approach. So if something else comes along, it's actually already there in the background. So from that perspective, I think what we've got is something that's not just for the here and now. It's for the long term.
What you're saying makes me very encouraged, feel very optimistic compared to some of the other news we've been hearing the last few weeks. And I think and I'm very grateful that you say you were inspired by my tweet. It's nice to know that that kind of thing can have a little bit of an effect.
Yeah, well, it is good. So it's good to be challenged, and thank you for that, because it did do exactly that. And as I said, I did get off my bum and went out there and spoke to friends and said, look, you've got skills, you've got experience, you've got networks. If we combine them, what could we do? And that's where it all started. So hopefully in a month or two's time, we can come back with some use cases for you and show you the different industries that are adopting it. And hopefully, the one for me that I'm quite passionate about is that, making the school environment safe. I think that's, for me, would be a really meaningful difference for all communities, really. Yeah, it's one of those things that unintended consequences, John. You are to blame.
Well, those tweets go out every week. It's an automated thing, and and I get so little feedback on them that it's just lovely to actually, occasionally I sort of sit there on the afternoon when it's gone out and challenge people to tell me what they've done, but you don't often get things. Yeah. It's nice to know that somebody's doing something that has a much bigger impact.
Yeah, well, fingers crossed.
All right.